Welcome to week 26 of the Mom is Fit week by week pregnancy update. In this video, you're going to learn what is going on with your baby during week 26 of your pregnancy, what might you be experiencing, and some solutions to those symptoms. And then I'm going to share how I am feeling during my pregnancy because I am currently 26 weeks pregnant and I am on this journey with you. So if you are also pregnant and you're watching this video, be sure to comment below to let us know how you are feeling because we would love to connect with you on this journey. Before we dive into what to expect during week 26 of your pregnancy, I want to share that my book, Training for Two, is now available for pre-order. Training for Two is all about how you can use your prenatal fitness to help support a strong pregnancy, a pain-free pregnancy, because pain is not a requirement of pregnancy, even though it can be common, and then also how you can use your exercises to prepare for birth with pelvic opening and pelvic floor relaxation exercises. You can check out Training for Two down in the notes below, and the book releases September 10th, 2024, shortly after this baby is due. So I essentially have twins being born this fall. So Roxanne, what can you expect for baby in week 26 of pregnancy?
So week 26, baby is the size of either a VHS tape, which resonates with me because I know exactly what that is, or spaghetti squash. I don't know if a spaghetti squash is the same size as a VHS. I think it's slightly bigger, but whichever one.
Well, not every baby's exactly the same.
Well, yeah, but I mean, if you're going to use size comparisons, they should probably be similarly in size, I would think. But I say this every week. So week 26, baby now has eyelashes on their eyelids, and they can now open and close their eyes because before their retinas weren't fully developed, and now their retinas are fully developed so they can open and close their eyes so they're able to see now. They're really only looking at the inside of your uterus and the amniotic sac, so not a lot to look at. They say if you take a flashlight and you place it on your belly, your baby will respond to the light. I don't really know how that light is so strong to penetrate through, but apparently it happens. Baby is continuing to swallow that amniotic fluid to practice breathing and practice eating for when they come out of the womb. And then they're also developing their sleep-wake cycle still. So as their nervous system continues to develop, that sleep-wake cycle is going to be more prominent, where you're going to notice baby is moving more often at certain times of days, and then other times they're sleeping. Just like when they come out, they're going to have times that they're awake and eating, and then they go back to sleep. It's going to be kind of similar times. So if baby's really active at night, your baby may be a little bit more active at nighttime when they come out, unfortunately. Their immune system is also continuing to develop as they're in the womb. So the placenta is providing all of those antibodies from your body to baby, so they're able to build up their immune system, as well as when they come out, if they're breastfeeding, they can get all of those antibodies from the breast milk as well. So you are a big factor in their immune system for now. So with you might start noticing, again, those practice contractions or Braxton Hicks, whichever one you know what that means. And those are the sudden tightening of your belly that may or may not be uncomfortable. And this is just your body prepping for labor. So it's preparing for what contractions are going to be.
But doesn't cause cervical dilation.
And that is the key with Braxton Hicks. As you get further in pregnancy, they might cause slight cervical change because some people will have Braxton Hicks and their mucus plug will come out. Doesn't mean labor is impending or coming. It's just they're practicing. So your cervix might change a little bit at the end. But they shouldn't be causing change at 26 weeks pregnant, hopefully, especially thinning of the cervix. But with Braxton Hicks, one of the causes of Braxton Hicks potentially could be dehydration. And that's usually where I will see people who have uncomfortable practice contractions and they're a lot more painful is when they are dehydrated because their uterus is I need some water in electrolytes,
I am
please.
parched.
I am so thirsty. And so they're usually a little bit more painful, I find, when someone is dehydrated. So another thing that we can see in this 26 weeks is you might be constipated or you might start having headaches. And those things could also be correlated with dehydration as well. Constipation could also be due to just the slowing down that naturally happens during pregnancy from the pregnancy hormones, our GI system. So your digestive system slows down and just takes the poop longer to kind of work through. And the longer it's there, the more water can be pulled from the poop. But if you're also dehydrated, your body's going to try to pull fluid wherever it can get, and that's where the poop is. There is no fluid there. Things that we can do to help with the constipation is one, obviously drinking a bunch of water to make sure we're hydrated, but also you can try increasing the amount of dietary fiber you're taking in, whether this is with your food, so increasing the amount of fiber you're getting from your food, or you can try adding in some like fiber supplements. So like Metamucil or even Miralax could be things that you can add in. I would probably start with the Metamucil first, though. There is some like other like off-brand dietary fibers, like colon broom is another one that is like supposed to be helpful with constipation, but I've never tried any of them, so I don't know. And then another thing with dehydration is headaches. Headaches are very common if you are dehydrated, but it also can just be like a normal symptom of pregnancy, unfortunately. This is due to, again, our hormones during pregnancy, as well as that increase in the amount of blood volume we have. And this is all can cause things within our body. Also, during pregnancy, we're at an increased state of stress. And if you have a history of headaches, such as like migraines or like tension headaches, this can increase those like likelihood of those happening during pregnancy, which is not the greatest experience. Also, fun fact, if you are anemic, headaches can also be linked to anemia. So if you have headaches and you've never had them before, get your iron levels checked, get your like blood levels checked, and maybe you need to start supplementing with an iron. But other than those symptoms, nothing really else is going on in the week 26. But Gina, how are you feeling?
So I have been having a lot of Braxton Hicks, which I think is pretty normal for me at this point. Like I'm fairly active. I have been a little dehydrated lately. So I need to drink.
Gina needs to drink some more Element.
I need to drink some more water. I was like in a phase where I didn't want to drink anything other than plain cold water, which I think was impacting how many Braxton Hicks I was having. And so once I started adding back in the Element and the electrolytes, they haven't been quite as bad. They were never painful, but it was just like sudden tightening of like the whole belly.
And like it makes you need to pee.
Yeah. Or it was related to me needing to pee would be the other thing. So I was either tired, so it's more prominent late at night. I'm a little dehydrated. Once I added in the Element, they kind of subsided, or I need to pee. And then once I go to the bathroom, it goes away. But I think the worst part of it is I feel like I can't move very easily when it's like super tight because it's just like uncomfortable. But it's never been painful for me, even in prior pregnancies. So just going to hydrate a little bit more, maybe rest some, and then just kind of go with the flow because they're not painful. Like they're not a problem for me. It's just like at night when I'm like laying there, my belly is super tight and I try to like move around. It's like, ugh.
And it's common to feel the Braxton Hicks more at night because there are still caused by like oxytocin. Like any contraction is still caused a little bit by oxytocin. And you are more sensitive to that oxytocin at nighttime because of the increased melatonin. The melatonin in our bodies allow us to be more sensitive to that oxytocin. So people might feel either labor contractions at night or Braxton Hicks more at night because of that increase.
I do also feel like constipation has been an issue my entire pregnancy.
Probably because you're dehydrated.
Probably because I'm dehydrated. But something that I have found to be helpful in addition to drinking water and eating food is to do some like little hip shifts when I'm sitting on the toilet, try to poop. And so I essentially just kind of add a little bit of like wiggly movement to my hips where if I was sitting on the floor, I'm kind of like moving each butt cheek backwards, but I'm not moving anymore, obviously.
Still, yeah.
Like I don't want to move all over my toilet as I'm trying to poop. But I'm just kind of driving each hip crease back, and that can sometimes help. Or I'll just focus on just the left hip back a little bit more, and that sometimes helps because I tend to have a little bit more tension to the left back half of my pelvic floor. And then also squatty potty.
Squatty
Bringing
potty,
my feet
number
up
one.
a little bit more is super helpful when I'm feeling a little bit more constipated.
Squatty potties are, if you don't have a squatty potty, even just outside of pregnancy, these things are amazing. We have them in every bathroom. They're the best. They have like cute ones too, so they're not like that old, the white original one. You can get like cute ones. We have like a marble faux one in this bathroom.
They have a foldable one, which I think is really awesome.
That's what I
you
have.
can throw it in your labor bag to bring with you. So I carry that in my doula bag with me. Because like not every hospital has squatty potties. I don't think I've ever seen one in a hospital. And so like when you're laboring on the toilet, having the feet a little bit more elevated can sometimes be more comfortable too.
I did that.
So they have the foldable ones, which are really nice.
One movement that I really like to do when I was like feeling constipated during pregnancy is the hip shift, but also just like on the toilet. Really like, because
Move
it's
your
like
mic and do that.
It's like circles on the toilet.
I mean, like
This like massaged my like abdomen, and then I do some hip shifts, and like, it was easy peasy with the squatty potty. So 3 things to do: hip
And
shifts,
belly massage, too.
circles. Well, the circles are massaging the belly. Obviously, when you're pregnant, it's a lot easier to massage your belly when you do the circles. That's why it probably works when.
So those are the things that I do. I added movement, drink more water, and squatty potty to help with constipation.
And we'll link the squatty potty below.
It's not 100% because I still have constipation, but it's a little bit better. I've also been feeling baby move a lot more, like kind of at like certain times, but haven't quite found like her trends yet. They're kind of whenever. I guess she's still figuring out her sleep cycles. Hopefully it's more to the day where she's awake, but we'll see. Usually it's like late at night. I feel her moving a lot more. And then like periodically throughout the day, I'll like feel her kind of kicking and rolling. But yeah, I don't know what position she's in. She's figuring that out, and we'll see in a little bit. So yeah, overall feeling pretty good. No pelvic pain. I did have a cranial sacral massage this week because I was having like a little tweakiness in my SI joint, and I don't know what she did during it. I felt amazing as soon as I got off from the table. When I do the CST massages, it's like really different than like a deep tissue massage, which I also really like. But these ones, it's like a lot more subtle and like gentle. And so during it, you're kind of like, is anything happening? And then when you get up off the table, you're like, I see now what happened. So I was having a little bit of tweakiness in like my left SI joint. She did like a little bit of like a CST adjustment magic thing on me, and I don't have any pain, which was pretty awesome. So yeah, overall feeling pretty good during week 26, other than the Braxton Hicks not being able to poop. But yeah, I think it's a pretty normal pregnancy. So thanks so much for tuning in to week 26 of what to expect during your pregnancy. You learned what was going on with baby, what might be going on with you, and some solutions to those things that you might be experiencing. And then I shared a little bit about how I'm feeling because this is our YouTube channel, so I get to share about me. So if you are pregnant, also share down in the comments below how you are feeling. If you have any solutions to resolving constipation, Braxton Hicks, are you feeling your baby move at more regular times? We would love to connect with you on this journey. If you want more support throughout your pregnancy, check out our online prenatal fitness programs and online childbirth education course. Our online prenatal fitness programs are offered in 2 main formats. We have our app-based format, which is self-paced workouts. So if you want to work out with like a barbell in a gym with a more traditional style of workout delivery, the app is a great option for you. If you prefer to follow a full-length workout video as you work out at the same time, join our prenatal on-demand program. We have our prenatal fitness variation of it, prenatal yoga, and then we also have our birth prep on-demand program, which is a standalone workout program to add on to your current workout routine. So if you're already doing another prenatal program or you already have a workout routine that you really like doing, but you want to add on the birth prep specific stuff, this program is a great option for you. And if you're looking for an online childbirth education course, you can check out ours. We have a self-paced program with over 9 hours of content where we break down the science of labor and birth to take some of that mystery away and make it less scary. We also discuss birth options as well as what your partner can do to support you throughout labor and birth. There's a little bit on postpartum care as well, but we also have a complete course on just what to expect in the postpartum for you and baby. And you can check out all of our offerings at mamastayfit.com and use code YouTube10 to get 10% off any of the offerings. We also have bundles with the prenatal fitness and our childbirth education course to save an additional 15%, which together it's like 25% off, which is a really great deal.